In the Southern Trust, we're constantly reviewing and realigning our services to ensure that we provide the best possible care. Most recently, the mental health teams have worked together to take the regional acute mental health care pathway, which has been co-produced by service users and their carers, and applied it to our standards and guidelines and to our existing services here in the Southern Trust. I'm delighted to see the advancement of our mental health services, ensuring our patients remain central to everything that we do.
Acute care doesn't always have to happen in the hospital. We know that people who receive their care at home have better recovery outcomes and stay well longer. We've developed this pathway to ensure that you receive the right service at the right time, providing a consistent approach from all of our services.
There are 4 key components of acute mental health services in the Southern Trust, which you'll hear about in this video. These are integrated liaison, the approved social work service, crisis response home treatment, and the Bluestone inpatient unit.
The integrated liaison service provides 24 hours, 7 days a week, urgent specialist mental health assessments. This means that if you're an inpatient within our hospitals, either in the emergency department or in the general wards, and have been assessed to require acute mental health care by the integrated liaison service, you'll be referred to the home treatment crisis response team.
If a voluntary admission to hospital is not an option for you or your loved one, an assessment under the relevant legislation may be considered.
Home treatment will be an integral part of your mental health journey. If you need acute care, we are your first port of call. We will carry out a mental health assessment, and if you need acute care, we can provide this for you in your own home on a 24-hour basis. This is equivalent to what you would receive when you're in hospital. It has been proven that receiving care by the home treatment team helps you to recover quicker.
If you are admitted to Bluestone, then we aim to make your inpatient stay as short as possible. Home treatment in Reach will be able to assess for early discharge and ongoing treatment at home.
Bluestone is an acute inpatient 24/7 service which provides a high standard of recovery-focused care and treatment to people who have a wide range of mental health diagnoses within a safe and therapeutic environment. Each of our wards have a large multidisciplinary team who meet daily with our home treatment team colleagues to review care and to plan for safe transitions home.
If you or your loved one require placement in a residential or nursing home, we will strive to ensure to get you that accommodation of your choice. However, if your placement of choice is not available, we will discharge you to a suitable alternative placement that meets your assessed care needs whilst awaiting your chosen placement.
I was referred to the home treatment crisis response at Trasna House after being discharged from hospital. They had suggested I needed inpatient treatment, and I trusted them with this. They were person-centred, working with me, my safety plan and therapist. They listened and reassured me, not trying to rush in and fix how I was feeling. They always had time, and I was never made to feel I was a nuisance. They were very patient and very kind. They didn't treat me any differently or make me feel less than. They just saw me, the person. This means a lot. I trust them like I never have a service before, and they have played a significant part in helping me heal from often unintentional harms done by services both here in Northern Ireland and my home country. They are open, honest, treat me with dignity, and give me as much choice as possible. They respect that I don't consider myself mentally ill, and as such allow me to make sense of my journey and experiences with what is right for me. Hearing stories such as this means so much to the staff who work across mental health services, and we value all your feedback.